Effects of aspirin for primary prevention in persons with diabetes mellitus. Definition: diabetes mellitus is associated with an increased risk of cardiovascular events. Aspirin use reduces the risk of occlusive vascular events, but increases the risk of bleeding. The balance of benefits and hazard for the prevention of first cardiovascular events in patients with diabetes is unclear.
In people with pre-existing cardiovascular disease, aspirin use is associated with overall benefit. Patients with diabetes mellitus are at increased risk of cardiovascular events, but the benefits and risks of aspirin as primary prevention in patients with diabetes are unclear. In this multi-center randomized double-blind placebo-controlled trial, 15,480 adults with diabetes but no evidence of cardiovascular disease were randomized to receive 100 milligrams of aspirin or placebo daily. The primary efficacy outcome was the first serious vascular event, defined as a composite of non-fatal myocardial infarction, non-fatal stroke or TIA, and vascular death. The primary safety outcome was the first occurrence of any major bleeding. After a mean follow-up of 7.4 years, the primary efficacy outcome had occurred in significantly fewer patients in the aspirin group than in the placebo group. However, aspirin use was associated with significantly higher rates of major bleeding. The majority of bleeds were gastrointestinal and extracranial. The numbers of fatal bleeds and hemorrhagic strokes were similar between groups. The authors conclude that as primary prevention in people with diabetes, low-dose aspirin reduced the risk of serious vascular events, but it also increased the risk of bleeding. Full trial results are available at nejm.org.
Application in medicine. We randomly assigned adults who had diabetes but no evident cardiovascular disease to receive aspirin at a dose of 100 milligrams daily or matching placebo. The primary efficacy outcome was the first serious vascular event. Pros and cons. Pros: reduce the risk of cardiovascular problems in people who have already suffered. Cons: gastrointestinal bleeding, liver disease clinical active, and a stroke caused by the blood vessel bursting.
Well, I think this is a very difficult question in a way, because we have to really try to estimate the risk of patients with diabetes. As far as we know, the guidelines, practice guidelines, are very controversial on this issue. There are guidelines who are very pro the use of aspirin in patients with diabetes, so in a liberal way, and other guidelines which are more concerned of the assessment of the risk. So patients with type 2 diabetes have a certain degree of risk, but within this category of patients, there are patients with a higher risk, and they for sure are entitled to have aspirin in primary prevention. We have tried to investigate in different trials. The most recent one, the ASCEND trial, was trying to assess the importance of having aspirin in primary prevention in patients with diabetes, but still we are left over with this uncertainty because of the balance between the benefit and the bleeding risk, which is there. And so I think we have to have a conservative approach and try to dissect the risk of a patient to the best of our possibilities.
Issue applied in Ecuador. In Ecuador, diabetes is affecting the population with increasing rates. According to the survey, the prevalence of diabetes in the population aged to 10 to 59 years is 1.7%. The proportion goes up from 30 years of age and at 50. 1 in 10 Ecuadorians already have diabetes. Conclusion. Aspirin use prevented serious vascular events in persons who had diabetes and no evident cardiovascular disease at trial entry, but it also caused major bleeding events. The absolute benefits were largely counterbalanced by the bleeding hazard.